Russo, 69, a retired engineer from Norwood, helps organize protests for 40 days in a row twice a year outside the Planned Parenthood in Boston.
There's two victims. There's at least two victims. There's the unborn child that loses its life. There's the mother, and there's also the family. Some of the most aggressively angry guys that people that come by here post-abortive have been men. I don't know. I suspect they don't have a choice. I don't.
You don't know anything.
I think that the anger that you see is caused by abortion. I think that they don't have a choice. I think that they see this as their only choice.
So in context of structural and symbolic violence, a pregnant person's rights and agency to determine their own bodily autonomy and reproductive destiny are systematically marginalized. And then, of course, if you also layer on a lack of race and class privilege, poverty, if they're living at home and they're underage, kind of all the other markers of marginalization, if they're homeless, anything else that is going to make it harder for them to access resources, that's just going to compound that.
Bela Ostrak is an assistant professor and member of the core faculty for the Medical Anthropology and Cross-Cultural Practice Master's program at the Boston University School of Medicine. Her areas of expertise include reproductive anthropology, access to abortion, and health inequality.
We know across the board people from every economic background, people that are married, people that are unmarried, people that are older, people that are younger, like everybody has abortions. But we do know that the abortion rate is higher among people that are lower income, and that's because those folks are also going to have a harder time getting contraceptives. Folks are also going to be in situations where they may be having a harder time preventing pregnancy. So depending on where you live, what you have to do to get an abortion is going to vary state by state. And then also how you can get it paid for is going to vary depending on whether it's totally out of pocket, whether Medicaid can be used, whether private insurance is going to be allowed to include coverage for abortion. So it really depends.
Jessica Silvey is a professor at the Northeastern University School of Law. She is also a lawyer who studies constitutional law with a focus on reproductive justice. As a full-time lawyer, she represented the Planned Parenthood League of Massachusetts.
So Roe v. Wade was the first time that the court recognized the essential nature of control over a woman's body and reproductive life. Roe was the beginning of almost 50 years of debate over, if it's not criminal, how can you regulate the abortion decision?
Russo said he's less interested in the legal side of the abortion debate or working to overturn Roe v. Wade, but that he did not want the government to fund abortion services.
If we live in a society that says, supports and pays for a woman and encourages a woman to bring her child here to have its life ended, then what does that say about the rest of our culture? It doesn't say anything good.
But according to Ostrak and Silvey, calls like Russo's and similar ones to defund Planned Parenthood are not grounded in the truth.
It's just a way of kind of drumming up abortion stigma. It's a way of kind of trying to get people to think that the main thing that a particular organization does is provide abortion, when in fact there's already a ban on any public funding for abortion.
And so the Hyde Amendment is an ongoing, reaffirmed part of a spending bill that basically says that no federal dollars will go to fund abortion services.
So for people that are in poverty and eligible for federal health care, it does not allow any federal funds to be used for abortion except theoretically in the case of a pregnancy that threatens a person's life, in cases of rape and incest. And so when you kind of use a congressional budget to try and take money away from something like Title X, which actually pays for routine cancer screening, pays for contraceptives, pays for pap smears, pays for just kind of basic health care, and particularly is one of the main providers of basic health care for a lot of low-income folks. When that is described as being abortion services, which it absolutely is not, because there's already the Hyde Amendment in place preventing any of that money from being used for abortions, it's just a distraction technique. It's a way of making people think that federal funds are being used for something that they already can't be. So most people in the United States, if they're in poverty, still have to come up with money out of pocket to pay for an abortion.